Perineal care. The purpose of perineal care is to not only clean the area but also to check for infections and lesions. The materials you'll need is disposable gloves, bath blanket, bedpan, liquid soap, basin, bath thermometer, bed protector, washcloths, towels, plastic bags, and a laundry hamper. You will knock on the door before you enter. You address the patient by their name and introduce yourself. Identify the patient by checking the identification bracelet, explain the procedure you will be doing to the patient, and provide the patient with privacy. You will prepare the patient by putting on your gloves. You will ask the patient to raise their hips so you can slide a bed protector underneath their butt. Ask the patient if they would like to use the bedpan before you get started. You will position the patient by raising the height of the bed, which is comfortable for your working standards. You will lower the side rail on the side that you will be standing. You will fold the spread and the blanket at the bottom. You will pick it up at the center and then you will place it over the back of a chair. You will assist the patient in the correct position and then you will spread the bath blanket. You will move the blanket so only the area between the legs are exposed. You will ask the patient to separate their legs and flex their knees. If the patient cannot do it, then you will do it for them. You will prepare to wash by wetting a washcloth. You will make a mitt with the washcloth, however you can do it, and then you will place a small amount of liquid soap onto the mitt that you made. For female perineal care, you will use one hand to gently separate their parts. You will use a clean washcloth to wipe in a downward motion. You will use the clean area of a washcloth for every wipe. You will repeat the steps, cleaning the inner near labia. You will rinse the entire area with a new, clean, wet washcloth, and then you will use a dry towel to dry it off. You will ask the patient to turn away from you. If they need help, you will assist them. You will have the patient flex their upper leg and then you expose the anal area using one hand and then you will lift up on the buttocks. You will wash the area by wiping in a downward motion and then you will use a clean area of the washcloth to rinse the area and then you will wipe from front to back. You will again use a dry towel to dry that area. For the male perineal care, you will gently hold the penis and using a washcloth, you will wipe the penis in a circular motion and then you will wash the rest of the penis moving toward the perineal area and the scrotum. You will lift the scrotum and wash the perineum. You will rinse the patient from the penis to the perineal and then the scrotum. You will dry the patient. If they have foreskin, you will position it. You will ask the patient to turn away from you. If they need help, you will help them. You will have the patient flex their upper leg, making a mitt with the washcloth. You will use a small amount of liquid soap. You will expose the anal area with one hand and then you will lift the buttocks. And then you will repeat the same step that you did with the female's perineal care. To cover the patient and restore linens, you will help the patient into the correct position again. You will get the patient to raise their hips so you can slide the bed protector from under their butt. You will dispose of the bed protector and then you will remove and discard the gloves and clean your hands. You will cover the patient with the top sheet. If they are unable to hold the top sheet by themselves, you will tuck it under their shoulders. You will remove the blanket, fold it, and store it. You will replace the blanket, spread, and tuck under the mattress. To clean up the materials, you will put on your gloves. You will empty the basin of water. You will clean your equipment and you will dispose or store of all the equipment according to your policy at the hospital. You will remove and discard your gloves. You will clean your hands and position the rails and check that the patient is comfortable and safe. You will place the calling signal within the patient's reach. Then you report all actions taken and any observations. Thank you.